Thank you for the invitation and giving me the chance to speak about physiotherapy today. Rehabilitation. Does it only start with visible impairment? This question could also be asked in a different, probably more provocative way. Why is physiotherapy only prescribed for patients with advanced impairments? Sorry, but it doesn't work. Yeah, thank you. I'm wondering whether physiotherapy is perceived with all its facets by the prescribing doctors, or whether there is a wrong, incomplete picture of our work with MS patients. Today, I would like to demonstrate that physiotherapy with MS is much more than just massage for relaxation, as well as strength or coordination training to preserve mobility. In their paper, Defining the Role of Physiotherapy in Palliative Care in Multiple Sclerosis, Kaur et al. Describe an important but often underestimated value of physiotherapy. It's the lifelong assistance of patients which aims for the best quality of life. I quote, "Its multifaceted approach, which includes not only traditional disease symptom management, but also improving overall quality of life for the patient and the family." Let's give the floor to Ms. Tanner, a young MS patient.
Therapie am Anfang gebracht. Das ist sicher einfach die regelmäßige Auseinandersetzung gewesen, dass ich hier von einem frühen Zeitpunkt an auf einer Sachebene einfach Fragen stellen und dass immer wieder Antworten bekommen habe. Und mit dem konnte ich es auch verarbeiten besser. Und ein anderer Teil war, dass ich hier wieder gelernt habe, meinem Körper mehr zu vertrauen. Das hat mein Wohlbefinden wieder gesteigert. Ich habe mehr Selbstvertrauen gehabt und ich habe mich nicht mehr krank gefühlt.
At the beginning of therapy, Ms. Tanner had specific questions and very clear goals. As a young, sportive woman with only subtle motor deficit, she asked for clarity about the form and intensity of physical activities she would be able to continue, despite of MS. With this, she addressed an important early approach of physiotherapy. Of course, we encouraged her to continue planning the cycling tours she had come to love. Furthermore, we discussed resting time to avoid fatigue during a daily stage and recommended the wearing of cooling vests on hot summer days. Sometime later, we received this holiday picture from a successful bicycle tour. However, we should not forget, there are people, presumably also among us, who prefer a deck chair over physical activity. This will not be changed by the diagnosis of MS, quite the contrary. The strongest factor to initiate and keep physical activity is self-efficacy expectation, the subjective conviction to reach a difficult goal based on own competences, even though hurdle may occur. A relevant study for physiotherapy by Plough et al., conducted with MS patients, concluded that there is a significant correlation between a decreased self-efficacy expectation and an inactive lifestyle. Another study by Choppy et al. Could show the reasons for this lack of self-efficacy expectation is a lack of information about possible physical activities and recommended criteria for their execution, despite of MS. So, to prevent this information deficits is another important approach of early physiotherapy. Together with the patients, a meaningful physical training is discussed based on their individual possibilities and ideas. Nowadays, there is a number of studies which show the positive effect of regular controlled strength and endurance training on MS fatigue, walking performance, improved endurance, but also on cognition, depressive symptoms, and therefore also an improvement of the quality of life. However, it's not enough to send patients just to the gym. Excellent instruction is an important, so that even subtle symptoms do not become a risk factor. Let me explain this using a practical example. At the time of referral, Ms. Tanner was walking without pathological findings. However, during the specific examination, we found a subtle increase of pathological extension tonus for the plantar flexors on both sides, shown by the Tardieu test. Even though a pathological extension tonus is not yet visible in motion behavior and is not noticeable by the patient, it is important to detect an increased tonus early, and especially during the early phase, teach control of spasticity to the patients. But what does control of spasticity mean? Patients have to learn not to use pathological synergies during physical strain or fatigue. During uncontrolled, overloaded strength training, the risk to use pathological motion synergies is high. As seen in this example on the leg press, the patient uses the extension and adduction synergy by uncontrolled pushing of the forefoot and pressing together both knees. However, allowing this would result in an enhancement of spasticity of the extensors and therefore a reciprocal weakening of the antagonistic muscles. Ms. Tanner therefore learned to pay attention to controlled pushing of the heels, as well as to keep steady distance between both knees on the leg press to achieve a selective and controlled knee extension. Also, we discussed with the patient, of course, the training weights, the number of repetitions, and the series. This instruction on exercise equipment to control spasticity, but also to avoid muscular fixations, which can be observed especially with coordination difficulties, cannot be made just by a fitness instructor. This is another specific approach of physiotherapists with education and experience in neurology. The support of MS patients in their self-management plays another significant role in the therapy of MS. Patients need to learn how to deal best with their individual difficulties and their resources. This includes patient tailor-based home-based exercises, which can be included in the patient's daily routine, if possible without need of exercise equipment. Since motivation to perform the exercises strongly depends on the perceived efficacy, individual choice of exercises, as well as excellent instruction in home-based exercises is paramount. The earlier the better also applies here. With generous support of the Swiss MS Society, we were able to film exercises for the daily practice at home. Based on more difficult everyday activities, such as, for example, stumbling while walking, an adequate exercise is proposed and the execution is shown with an affected person. Just let me show an example.
Ich mache jetzt Bodenmagnetübung, dass ich nicht hängen bleibe oder stolpere beim Laufen.
Aufrechter Sitz auf einem Stuhl, die Füße sind auf dem Boden. Die Hände liegen bequem auf den Oberschenkeln. Der rechte Fuß steht unter dem Knie. Der linke Fuß wird so weit nach hinten gezogen, bis die Ferse automatisch leicht abhebt. Die Ferse soll wie von einem Magnet angezogen in Richtung Boden bewegt und einige Sekunden in dieser Stellung gehalten werden. Danach die Spannung wieder loslassen, die Ferse schwebt nun über dem Boden. Die Übung können Sie 2- bis 3-mal wiederholen. Achtung, kein Hochdrücken der linken Ferse. Die rechte Ferse bleibt am Boden unter dem Knie stehen. Der Abstand zwischen den Kniegelenken bleibt gleich groß. Als erleichterte Variante schlagen wir vor, die Übung im angelehnten Sitz durchzuführen. Diese Übung eignet sich gut als Vorbereitung zum Gehen, immer bevor Sie von einem Stuhl aufstehen, beispielsweise nach dem Frühstück.
These videos are going to be uploaded to the website on this year's World MS Day and will be hopefully motivate many MS patients to meaningful home-based training. After excellent instruction of home-based exercises and advice on individual possibilities during early stage of the disease, weekly physiotherapy is not necessary. However, it's recommended to review and adapt exercises at longer intervals. Additionally, many appreciate the security of having a confident physiotherapist as a contact person when new challenges emerge or questions arise. Furthermore, it's of advantage to be able to compare the current condition with earlier time points when therapy is resumed or intensified, for example, after a relapse, to adapt therapy to the current difficulties of the patient. The disease pattern of MS is complex. The symptoms vary a lot. Therefore, for physiotherapeutic advice and instruction, specific knowledge and experience on the part of the physiotherapist is absolutely necessary. For this purpose, 15 years ago, the expert group Physiotherapy for Patients with MS was founded, which is committed to the further education of physiotherapists in the area of MS. Since 2003, a certificate course leading to the qualification MS therapist has been offered in Switzerland. In 2022, the education was taken up as a certificate of advanced studies program at the University of Basel. Participants acquire an in-depth knowledge of evidence-based examination and treatment of MS patients. To facilitate the search for physiotherapists from MS patients and their prescribing doctors, a Swiss-wide list with physiotherapists specifically qualified to treat MS patients is maintained by the expert group on their website. Let me summarize now the most important approaches of early-stage physiotherapy with MS. The physiotherapists inform, advises, and motivates patients concerning physical activities. They instruct and discuss a personalized medical exercise therapy. They instruct and review home-based exercises and detect changes early. The physiotherapist is an important confidant and contact person in case of question and insecurity for patients. Give your patients a chance to benefit from early physiotherapy. Thank you.
Thank you very much for this very interesting talk. Are there any questions? Maybe I can ask you the first one. I understood that the videos are available on a website, but I didn't get on which one, on the one of the MS Society or on yours?
On both websites.
Ah, great.
Yeah.
Any other questions? Yes, up there. Do you have a mic?
A very pragmatic question, Regula. Thank you very much for your presentation. Do you ever have any problems? Do you hear from people who have problems getting the early physiotherapy reimbursed from the health insurances?
Yes, I know this problem. But I would say that physiotherapy with a neurological patient that is described as a therapy as a complex therapy. So you don't have to do a real written justification why you just prescribe a complex therapy. It's just written in our contract with the assurances.
Would you describe physical or physiotherapy at that stage as a preventive measure or as a treatment measure?
Well, in the really early physiotherapy, it's more the preventive character, and further on, it's going also the treatment. Yeah.